So I think I look like a vampire right now, literally.
Sorry for being a mess. I gave my best, but was too late. Yeah.
Alright guys, so I'm at Golden Aesthetics now, and they're located at Hargreaves Complex at Suite 18. So I have a form to fill out, and this is standard procedure before you actually begin any sort of procedure here. I'm here with Dr. Stacy and Golden.
Hi guys.
And we are at Golden Aesthetics. So please tell them what we're going to be doing today.
We're doing 2 procedures with us today. So we're doubling up, we're doing a Botox today for the forehead and frown area, and we're also doing microneedling today.
Tell me what the pain level is concerning the Botox, and then you're going to tell me what the pain level is for the microneedling.
Alright, first of all, the pain threshold for everyone is different. However, we do numb prior to the procedure.
Right.
So I would say the microneedling is very superficial, meaning just doing 1 to 2 millimeters into the skin. So the pain level for that is less than for the Botox. For the microneedling, I would say 2, 3 out of 10. For some persons, it's a 0 out of 10. While for the Botox, I would say on average it's a 3 out of 10.
Okay.
Really, and the procedure does not last long, so I would say very tolerable. Okay guys, so the first thing that we'll be doing today is we'll be cleansing the skin. We have an enzyme cleansing gel. It's very mild on the skin, so we find that this works for majority of skin types. So we're just giving our skin a proper cleanse.
For people who have like hormonal acne, it works for it as well.
Alright, so what I do prior to the microneedling is a thorough consultation, and most times it's going to be a multimodal approach. So we're going to need to control the hormones, we're going to need to be exfoliating, so your at-home care is going to be very important, and at times I do prescribe other medication to go along with the microneedling sessions, which we do recommend at least 3 sessions for good results, for the best results.
What's the time frame between?
Alright, so it's a month to 6 weeks between each session. Okay. But at the end of the day, there's not really a limit to say you have to do 3 sessions and then that's it. I mean, you can always continue to get the treatment. I mean, you give your skin at least 6 weeks in between, or you can change. What you can do after that 3 sessions is change the frequency. So instead of getting it monthly, you can get it every 2 months.
Oh.
It's quite safe because we're using plasma. We just cleanse her skin, and we'll be applying some numbing cream, and then we're gonna go ahead and do our Botox, and we're gonna do our microneedling.
Alright guys, so the numbing cream is on my face now. I'm gonna sit here or lay here for about 15 minutes. So hopefully it works.
In order to be efficient with our time, while the patient is numbing, we go ahead and withdraw the blood for our microneedling facial with PRP. So basically PRP is a component of the blood. So we draw the blood, we spin it in a machine, and we extract the red cells, which we do not need, and some of the white cells. Make up this one. So basically Botox is a neurotoxin. What that means is that it targets nerves. So what it does is lessens the signal coming from the brain to the muscle. Alright, so raise your eyebrows for me. Alright, so we marking the outer borders of what we call the frontalis muscles. So we have the left and the right, and they're coming up like this, and they're responsible for pulling up the eyebrows. Do about 2 units per dot for her forehead, right? And then I'm gonna ask you to make a frown. So I'm gonna do 1, 2, 3, just a little. For the areas really close to the eyebrows, I'm gonna reduce the unit as well as the depth of my injections when I get to these places. Don't want any complication. We don't want any dropping of the brows. I'm gonna feel just a little pinch, okay? So it should be really manageable. Make that frown. So you definitely know that something is going on. There is a pinch right there. And just above the brows, we are putting half that dose.
Also, do you see results?
So, yeah, that's a good
It's
question.
like a couple of days.
Alright, so in terms of the effects of the Botox, which is reducing the action of the muscle, we're looking at about 5 days. It starts, you'll see some reduction in the movement, but 10 to 14 days for the maximum effect to kick in. So what we've seen basically is like she having some bites, just some little stings, and that will basically calm down within an hour pretty much. So
I think because of the numbing cream, but basically I would say a 3 out of 10.
right, your skin heals from the microneedling, your Botox kicking in, and you're just looking fantastic.
Snatch!
Yeah. Just attached is a one-time tip. It's a single use for each patient. All right, so this is our plasma or platelet-rich plasma that we'll be using today. What we're doing is using this as a mask. So actually, there are different types of microneedling. Every type of vampire facial is a microneedle, but not every microneedle is a vampire facial. So we call it a vampire facial because we draw the person's blood, and the microneedles can sometimes rupture small vessels in the skin, and we have a bit of bleeding. So that's why it's called a vampire facial. What is this for? It's good?
That's fine.
Okay. For microneedling, we recommend that you keep the plasma overnight. So just keep it on for as long as possible for the best results. So what we're doing with the results that we're getting with the microneedling, we're brightening the skin, we're reducing hyperpigmentation, we are smoothing the skin, decreasing pore size, just getting a more refreshed look overall. So we're looking at a week to 2 weeks for the downtime. And when I say downtime, it's not going to stop you from living your everyday life, but you might experience some peeling, and then you're going to see the beautiful skin being revealed. See, the skin is becoming red, which is good. It means that we're having increased circulation to the area, and we're having a little bit of rupture from the needles. It's not as bad as it sounds, guys. Remember, the needle is very tiny. It uses to repair itself. So by using it for the vampire facial, we're triggering a reaction where healing is going to take place in the skin, and we're increasing collagen and elastin in the skin. And we can also do a Botox facial, and that involves mixing the plasma with some Botox. A few units of Botox, and we get really good results.
I think it's a 4.
Okay.
Yeah.
And this is
I feel like the reason why it's, I don't know if it's because of the Botox that was done before.
Where I made it. That's possible. That's possible. The forehead in general is like a little bit more painful.
Okay.
Yeah, because they don't really have a lot of fat pads to push on.
Right.
I find out if you have active blemishes, which you have just a little black here and here, then you might see they start to like exude some water. Okay, so don't be alarmed, just cleanse the area up.
look like a vampire right now, literally. So we're gonna walk around to where we're gonna get the red light done, yeah. But my face feels really like tight right now. Yeah.
So this is called red light therapy. Basically, it's pretty safe. So what it does, it helps to speed up repair. If you're ready, yeah. It speeds up repair by giving energy to the cells, pretty much. So this is a nice treatment to pair with the microneedling, and we're gonna do this for 20 minutes. Okay.
Alright guys, so I just got done with the red light treatment for my face. My face feels really stiff. You see what I'm talking like? Yes, it feels really stiff. But I'm not feeling any pain at all. What's the cost for microneedling and Botox of the forehead?
Okay, so microneedling currently is going for $150 per session, and there's a special for $130 per session. We might extend it for August as well.
Right. So if you mention me that you saw it here, then maybe you can get it for $130.
So right here, this is some saline,
okay,
like salty water.
Okay.
And this is a gauze. So you're gonna try to keep it like this as long as possible. And then if it gets too dry and stiff, you can just
apply
the area.
Okay.
This is a sponge you're gonna use tomorrow for cleansing.
Okay.
And some Botox aftercare tips.
Okay. What other services do you offer besides the Botox on the forehead, microneedling?
We use Botox also to treat excessive sweating, so hyperhidrosis treatment. We do fillers, so under eye, lip fillers, and to replace volume in the face. And our favorite is to pair that with neurotoxins, which we did today, which is another name for Botox.
Okay.
And we do thread lifts with PDO threads. So we can do other videos on that for more. That's going to be a lot of explanation right here, but PDO threads.
Thank you today.
You're welcome, and thank you.
Yeah, and the staff here, guys, super friendly. I have to say that, super friendly.
5 hours later.
So remember this care package that I got from a gauze in there, and it has this solution. So my skin feels really dry. So what I'm gonna do is this solution that she gave me, I have to apply it to my skin. So I'm just taking a little bit of the solution, at least some of it. She said I could just use some of it. Probably don't have to use all of it. And the only thing about like the microneedling is that like because there's blood on your face, literally blood on your face, it kinda, earlier when I did it I could smell the blood on my skin, and I don't like the smell of blood. The pain level, I want to say 3 out of 10. My forehead was about 4 out of 10, and across here was about 4 out of 10. I am gonna sleep in it like this. I kind of feeling like a little bit of tingling sensation since I used the solution on my skin. This is the day after microneedling, and my skin is looking really red. This moment in time, I just rinse off or wash off all the blood and plasma that was on there. So I did my skincare routine, I cleansed, and I applied my toner, and I used moisturizer with SPF in there. So basically this is what I'm gonna look like for the entire day. Unfortunately, I have to head out today because something came up, but yeah, this is what my skin looks like. Good morning. Hi. Alright, so I wanted to show you guys what my skin looks like right now. So let me bring you guys in closer. As you can see, I'm stripping around this area. Squeeze these or nothing. I'm just not gonna irritate my skin any more than it's already irritated. I've been doing my skincare routine like normal. Just haven't been using like the active ingredients and stuff like HA, BHA. I just literally been cleansing, using my toner, my vitamin C. I haven't used my vitamin C yet, and like my sunscreen, my moisturizer. That's what I've been doing basically. But yeah, this is what my skin, I hope you guys can see. My goodness. But yeah, this is me. Yeah, I'll show you guys what I look like in a couple of days, I guess. Hey, so final update on my skin. It's been 1 week now since I've done the microneedling and the Botox. So my skin looks, there's a big difference in my skin. I don't know if you guys can tell, but I can tell what my skin looks. Matter of fact, I saw a big difference in my skin like 2 days after. After the stripping went down, the stripping went away and stuff, the shedding of that dead skin on top went away. I could literally see like a brighter looking skin, and this problematic side that I have going on here is a lot less than it was before. I don't know if you guys can tell, but I can kind of tell. I'm having 1 and 2 breakouts at the moment, but I want to say that overall I'm so excited about my next treatment, which is going to be at the end of August thereabouts, so about a 6-week period between each session. So I'm super excited, because if first session got my skin looking a lot better, I can just imagine what the second and the third one is gonna be like. So I'm super excited about that. With regards to the forehead Botox, so I remember in the video Dr. Golden had mentioned that you'd see it kicking in like what, 10 to 14 days or something like that, but mine literally kicked in already. Like by the next day, I think I went to the gym like the day, like maybe 2 days after, and when I went like this, my frown, this is me frowning so hard, literally nothing. And I know you guys have seen further in the video where when I did frown, you'd have seen here knitted really badly, and then you saw a little bit of my forehead that was, so I'm actually raising my brows right now, and then there's nothing there, and then I'm frowning, I'm trying to frown, but you can't really see anything here. So it actually kicked in like less than a week, kicked in. The stripping also, she had mentioned in the video that about downtime, about a week or two. Child, I was back at work 2 days after. Like there was a lot of, there's a little, there, I wouldn't say a lot, but there was some bruising like on this side and this side that didn't go away. Maybe took about 4 days to like fully go away. But overall, it's a quick time. It's not no downtime. I wore my mask. Nobody hardly realized that anything was happening. So it's really a quick procedure. So yeah, this is my final update on my skin and my face. I hope this video was helpful. Leave me a comment and let me know what you think. Big up on yourself. Remember to like this video, and of course, love you guys. Thank you so much for watching. Until next time, I'll see you in the next one. Bye.